My idea was about the end user being a professional who has maybe lost their job. And as they're trying to juggle paying their mortgage, keep their car, those sort of things, they could really use the resource of the food pantry. So how do we destigmatize using the food pantry for this end user? One, I thought if maybe there was a way to advertise what it actually looks like and what they're actually giving so that they're not thinking, I'm gonna go and there's gonna be someone with 10 kids and I'm in a long line of folks and everyone's gonna see me. The other was maybe if the websites can show what sorts of foods are being provided each week, that helps me to understand what I'm actually going to get when I come to the food pantry. And the last, we all like to feel useful and helpful. So if I could come in and volunteer for the day, help hand out food, I feel like I'm giving back and paying for my food in essence. And then at the end of the day, I can take my box of goods, go home, share them with my family, and that way I'm also not feeling like people are gonna see me standing in line. Or if you can't volunteer because you're trying to take care of kids and find a job, maybe you do some sort of donation plan, like I will use the food pantry now, but once I'm back on my feet, I'd like to donate back $500 and I'll pay it in increments over a year or something.
I think everyone here's probably been into like the New York City subway where they have the kiosks, which are like symbol-based and touchscreen. So my idea is a kiosk, symbol-based and touchscreen, but also with multiple languages in malls, in high traffic areas near bus stops that would tell people where they can get food. So it knows exactly where you are, and you type, you put your request in, and basically it would give you a little printout of the closest food pantries, the hours, and how to get there, transportation-wise.
Okay, I would like to augment our food pantry and food pantries of small organizations who are serving people who are formerly homeless or very poor with recipes, simple recipes that would help them take the food items that they're given at the food bank and be able to create some simple meal for their family. So one of the things we would do as they come in is to assess, do they have a can opener? Do they have pans at home, means to cook, a microwave? Might we get some of those items donated from some of the local stores to have them there? And then to use our interns, perhaps from a culinary institute or university or a mom with kids who can help us create very simple recipes that are kid-friendly and healthy. So that when they get the food home, it's not going to simply be just a raw selection of different things that the kids may not like, but hopefully they could take the simple items, put them together, and create a meal that would be healthy for them. I hope in this way that the food pantry donations that are received and the ones that we get from the food bank might be better used to keep our kids in the area healthy.
The idea that I had was really to address the convenience and autonomy of the end user and to take a look at an opportunity where electronics or technology might be able to cross into the delivery of the actual food items. So by allowing a person to go online wherever they might be able to access, a lot of our program participants do have iPhones and access to technology, to really have them have the ability to select what type of food items they would like from, and I'm kind of borrowing from the whole Amazon Whole Foods thing where they can actually go online and there's a cooperative that feeds that particular site. And someone can select and then have it delivered. Not sure how that would happen with delivery, but thinking about the fact that the whole stigma that a lot of folks have talked about, how do you get food delivered safely and quickly to a home where you don't have the end user, mom, dad, or such, that they have baby, 3 little children, transportation is difficult to get out there.
My name is Don Webster. Thank you for allowing me to participate with you today. Really quickly, my idea was a raise awareness campaign. Our stakeholders are 2 different kinds of groups. There is the end user that needs the services, but I also propose there's a larger group of us in this community that are not aware, like the experts in this room, of what the problems are that we're facing, and so I would like to see some information that we could get out to our larger group so that they could then, in fact, help solve this problem to a greater degree. So the feedback from my table was we originally started with this concept of a centralized web page. Maybe that's at the county level, maybe that's at the city level. Another dimension would have to be, what about for those people that do not use technology, and how do we educate them? But the idea is that we would bring together a group of educated professionals like yourselves. We would identify things such as qualifications, benefits, what's the challenge that we're facing in our community, and in particular, possibly address some of the stigmas that are associated with why you should or shouldn't participate in this program. Second piece would be that we would actually create solutions for this location. So for example, locations, a very obvious one, but qualifications, where to go for more help if you need it. And finally, the resources to support it, whether it is to build it or to maintain it, and how you would make it happen.
My idea follows that as well. It's the creation of an app that would help individuals that probably benefit from SNAP or are working poor individuals but do have access to either phones or online services, may have gone to their doctor or to the hospital and get referrals for food, pharmacy, etc. But these individuals basically would access the app. The app would give them a map based on what they're looking for, if it's vegetables, etc. The app would tell them the best prices and locations where these fresh foods are available. If they hit on that location, they would figure out exactly how to get there or how to order for delivery and receive the information. The app would also have sort of like a community education component to it, so that if you have diabetes, high blood pressure, etc., you could look under your condition and find out which are the foods that are best for you to address those conditions, and what are the wonderful recipes of really yummy food that you can eat, and maybe hopefully how to prepare them. So that's my idea.
My idea is a systems idea, and it involves marketing to various populations. So food does exist in our community right now. How do we get it to those who need it? I think we have to market first to key collaborators, which are, I think, faith communities, health providers, schools, counselors, employers. The whole population needs to know where you can get food and how you can get it. And I think from our 2 meetings, there's a lot of people that are learning this right within our midst. So I think we could do a better job of getting it out there. General pantry information. The marketing, I think, could utilize a lot of the ideas that went before us. The kiosks, the apps, the whatever. Because have them playing in offices, have hard copies for those who are not techno giants. Kid-friendly devices so that they can be able to pick it up somewhere and get information on what is healthy food. Any way that we can to a variety of populations, all age groups, to be able to utilize what we have now and then improve on what we need.
Starting with the children, educating the children in schools about healthy food, which requires educating the teachers how to educate the children, and then schools providing healthy foods, because many kids may only have a meal of the day or so at school. So we need to be able to provide the schools with that healthy mix of items. Now, that involves also supermarkets and groceries, to where they provide healthier food at a lower cost than the other. Now, that may require government intervention through policies that would enable supermarkets to provide the foods for the schools and so forth. McDonald's and the fast food industry, now they have been moving towards providing healthier meals. I don't think they're moving fast enough, which means government, policymakers would have to come up with a way to incentivize the fast food industry. So
I suspect that people who are in need food and are food poor are also transportation poor. And so I don't know how it works now, but my thought was you have a centralized food pantry like the Weinberg in Pittston that has trucks, refrigerated trucks, and let's just say it's one, and that one refrigerated truck and that driver goes, identifies neighborhoods at risk. So there might be 3 in Scranton where most of your customers live. That on Monday, that single truck would take food to that neighborhood. There'd be an identified site And, you know, Tuesday, Wednesday, Thursday would just be those different neighborhoods. Kind of a simple distribution method and taking the food to the customer instead of having them have to come to you.
I'm Sandra Roberts, and I'm Executive Director of the Bread Basket, which is the state food distribution for Lackawanna County. My thought is, I have a pantry full of food, but what I'd like to see is I would like to see more of a collaboration between the hospitals, okay? I have several calls from hospital social workers, all right, who call me and they have a client who keeps on coming to the hospital all the time, and the hospital can't get this person out of this pattern, and it's costing the hospital a tremendous amount of money. So what I'd like to do is, I would like, in a perfect world, take the dietitian, which we're educating dietitians out of the gazoo, especially at Marywood, right? And take those dietitians or social workers, pair them up with the recipient, okay? Have the computer work that dietitian and that recipient together, okay, on the type of foods that they have, either the foods from the food pantry or the grocery store, get that list to the grocery store. And yes, I think the one thing we all agree on is delivery is the key, not necessarily transportation. Thank you.
Hi, my name is Tammy Marcinkiewicz. I'm Community Services Director for United Neighborhood Centers, and we do have a food pantry. What I would like to see is more options for fresh foods. We have been working with the Food Policy Council, and we've been working with several local small farmers, being able to get fresh fruits, fresh vegetables into our food pantry, and I just can't tell you how much the families do enjoy that. It's better for the families. They don't want to see the canned foods. It's just they're not good options for the families. I don't know how to get that word out to the community, to get those more people to bring that into our food pantry, those donations. We've worked a little bit with the community colleges, Penn State, some of the smaller agencies, just to bring in, they drop off some of their vegetables and fruits, and they go off of our shelves quicker than anything else that we're able to put over there. So I really, really just encourage everybody to bring over any of the fresh fruits and vegetables that they do have. Thank you.
So my idea has to do with a distribution system, and one of the challenges with our current system is that we have a lot of different partners that are doing some sort of food provision, and they all have access to the food bank, but we might be receiving 20 plus food orders, deliveries going back and forth from Pittston to Scranton in any given week. And so we have at least 2 partners that have local warehouses. And my idea is to kind of combine that into one central Scranton subsidiary distribution organization that would allow our local food pantries that perhaps don't have the transportation resources to get back and forth to the food bank more than once a week. You just heard Tammy talk about fresh food. So how can we make that possible for our pantries who might be open 3 days a week, but they can't get to the food bank 3 days a week?
Okay, my name is Steve Boyce. I'm a cardiologist at Geisinger. Grew up in the area, so that's my area of interest here. What we talked about, or what I talked about, was you have patients or individuals who need food, and you need to get that food to them in some way. I think there needs to be a better line of communication in the setting, be it marketing, TV ads, radio ads, etc. But also I think we need to take it to the community level, for those community stakeholders, at a culturally relative spot. So I'm talking about going to the religious leaders, going to the VFW, putting that information perhaps in a hard copy into those spots so people can see it. If they go to the physician's office, great, but you're only affecting those folks that are going to physician's offices. You need to go to those folks wherever they may go, their churches, their local social areas that they would tend to go to, their community centers, their places at where they live. So that's what I see as the biggest idea, is getting the information to those individuals, and with that culturally relative, community-based people that they trust also incorporate the education for perhaps what is good food, how do you cook it, etc. So that's the thought process.
Looking at the data options. So we have a lot of interesting stories that we're continuing to hear, but utilizing the universities, the local universities, to actually create focus group templates to be able to utilize the trusted relationships that they've created, those who are accessing the food pantries, to actually go through the process of 10 to 12 interview questions to really create not only the profile of the people that are accessing the services, but what are the true needs. And so we all have individual perspectives of what they are, but to hear them from the individuals, because if transportation is a concern, then how is it that we're learning that from the people who are accessing the food pantry? So like, is that really the root cause and the concern? So how do we start to gather some of that additional information to be able to bring that back together? So as we pull together from the 10 to 12 food pantries, 10 to 12 focus groups, begin to create that profile for the community that we can begin to make changes within the distribution center, maybe it's mobile distribution, different things to be able to meet those needs.
If you bring it to me, I will come. More of a community center where individuals can come, obtain their food, have cooking lessons, because I don't know what I don't know. I don't know how to prepare this food. So if I can learn it in a community setting and then expand those services to other health-related and social events, that it would eliminate the stigma that I feel about going to a food pantry, as well as the transportation issues that I may have.
My name is John Cosgrove. I'm Executive Director of All One Foundation and All One Charities. We're a health care grant making and convening entity out of Wilkes-Barre, cover 13 counties. So the idea is to get healthy and appropriate food to people with very specific needs. And the first need identified was children with celiac disease. How do we get food to people with very specific needs? Starts at home with the concern addressed by the parents. We're working with the clinics and the primary care folks to get an actual diagnosis and the understanding of what kinds of food children with celiac need to get. We're working with the food providers so that they understand the issues, what kinds of foods, and cross-contamination. Some of the feedback we received was very helpful in that in Scranton we could identify single source providers for very specific dietary needs, and also that we could work with the private sector, places like Wegmans that understands cross-contamination and celiac disease.
So I think we need to centralize our resources and decentralize education about those resources and the delivery of them, and stop stigmatizing and centralizing delivery, but really put it into intentional platforms that honor wellness, like in our school districts and in our primary care environments. I think we need to develop a software tech platform that is a volunteer care network and time banking management system, so that we can collect all of the resources in the community, including staffing time from Girl Scouts, intramural sports agencies, high schools, and emergency rooms and primary care clinics, so that we can actually empower the community to self-manage their food security.
Came at it from the perspective of the consumer, and I focused on consumer access and dignity. One of my ideas was to bring the food to the consumer at both senior centers and at schools. Okay, so that way we can tap into volunteerism and we can tap into already existing networks that already do provide meals, both lunches and congregate meals to individuals. Another part of that is that we could use senior centers and schools as community access points, because they're the easiest points for both children and seniors to get to. We can bring in healthy options for the congregate meals, we can bring in healthy options for the school lunches, and have those options available for students when they are leaving, and for seniors when they're leaving the senior center that day. The other piece of it is the dignity piece. They leave without feeling that they had to go to a food pantry. We can access the kiosk model, and we can also use a register system to make sure that they feel like they have the ability to contribute that day.
Hi, I'm Director of Human Services for Lackawanna County. We deal with thousands of the poorest of the poor within our county. One of the things that we've determined, in addition to access, is education. So what we propose is on our intakes, to do a nutritional profile of the families, work collaboratively with them so they're not stigmatized, look at what good foods that they have in the house, and then see how we could supplement that over time. And then using that assessment, giving them access, preparing like a model order for them. Because again, we have the captive audience, we have the intake, and we know that they want their kids to be well, but we also know that they equate caloric intake to nutrition. And we know what they order is not necessarily they're going and ordering prepared foods, hot dogs, those kind of things. So we think that if we could start embedding that into our intake process, like the other screenings that we do, that we'd be able to sustain the model and actually have them use all the great resources and ideas that have been promulgated here.
My name is Cindy Kennedy, and I'm the Director of Operations for Maternal and Family Health Services. And some of my idea has been talked about today, but looking at the primary purpose of creating health education at food centers is the most important thing, I think, because in the end, if we just distribute the food, but we don't educate the public on how to utilize the food, then therefore they won't sustain a healthy lifestyle. So, and take into consideration one of the programs that we have at Maternal and Family Health Services, the WIC Nutrition Program, which shows fabulous outcomes for the health of infants and children and their families in a very long-term view. So why don't we look to that type of program model to have education like the WIC Nutrition education at the food pantries, so that families are educated on healthy foods and they can sustain that healthy relationship with food, and it would provide better outcomes in the end. So that we're not only distributing the food, but we're educating them on how to utilize healthy foods.
I'm Ann Salerno from the Scranton School District, and our children have access to food Monday through Friday while they're in school through the school lunch program, through the fresh fruits and vegetable program, and then monthly CEO Weinberg and the United Way provide 3 of our schools with an excellent children's produce market with fresh fruits and vegetables that all of our elementary schools can access. But our main concern is that meal that they have at lunchtime on Friday, what do they have access to, and do they know what opportunities exist for them to get food over the weekend until they come back to the school on Monday in order to get the breakfast. So I would just like to see a focus on what is available in the community to make our families aware of that, and to see is there a lack of resources available for over the weekend and what we can do to pool our efforts to correct that. Thank you.
Good morning, my name is Shelley Passaretti. I'm the Director of Health and Wellness for Geisinger Health Plan. Just like many people in this room this morning, my idea was around improving access to food and removing the transportation barrier. So one idea that I had was to use the clients who access the food pantry, use them as volunteers to kind of pay it forward if they do not have transportation barriers. And another idea was to partner maybe with Life Geisinger here in the Scranton area. They have vehicles that are unused during business hours that they may be able to either help clients and bring them into the facility or help deliver food.
Hi, my name is Paula Keenan. I'm the nursing officer at Scranton Primary Health Care. And the ideas that I had thought of too were already said many times today. But speaking from a patient point as versus consumer, Sister's idea of marketing, to me that would be the place to market is at our center. And for our providers, when we see a lot of ethnic issues that affects their health, so to be able to have in their language and to direct them to where to go and recipes, healthy eating, I think would be beneficial to them to sustain their lifestyle and then try to prevent some of these diseases or improve on them.
Hi, I'm Kathy Fitzpatrick. I'm the Grants Administrator at the Scranton Area Foundation. And when I sit here and I listen to all these ideas, I see that there needs to be like a major local public awareness campaign on the food issues right here in our area. And we always say that the best way to get the needs story out is through stories, through local stories of people, not just of the low income, but also of people that have been currently unemployed or elderly people that have access problems to food. And then make people more aware of the needs right in our community and try to get more people involved in the problem and work collaboratively, the people that are in need as well as the people that are able to help
I'm Maggie Bushwick. I'm a social worker at Jewish Family Service. We do have a kosher food pantry, specialty pantry at Jewish Family Service. Most of you probably do not know about it. But my idea was here, we have pockets of different backgrounds of people in different countries who have their own cultural foods that they use. I'm not sure that the food pantries have their food. So even if they would come to the pantry, they might not get the food that they're used to or would like to use. So I would like to see more education, both directions, from the consumers to the people who provide the food, and from the people who provide the food to the new consumers. What is available here? What do we do? What kind of recipes? How can we integrate all the cultures together to make healthy food here? And then my idea was also about sending the food to the people who need it, especially the elderly, instead of them coming to the pantry, sending the food to their houses.
I'm Joe Hollander, Executive Director of Scranton Primary Healthcare. My thought that came to mind was, you're all familiar with the concept of a bookmobile. Imagine a foodmobile. So, for example, one day a week, foodmobile parks outside the United Neighborhood Center's Adult Daycare Center. Another day of the week, they come to our healthcare facility. Our providers, at the end of a visit, give the patient a note that explains what their particular issues are, whether it's a diagnosis based on high blood pressure, high sugar, diabetes, things like that, whether it's cultural issues, as you heard expressed a couple different times today, where their diets just don't tend to necessarily lead to better health issues. So at the same time, we're providing them fresh food and good product to eat. We also have nutrition counselors available with simple and easy to use recipes, culturally based, as well as in variety of languages based on our consumers, and just bring the product to the consumer instead of forcing the consumer to seek out the facility that works best for them.
My name is Zachary Kenny. I work at the Community Intervention Center. So I kind of attack this problem from the perspective of my clients. Really quick, when I was in high school, we had a nutritionist come in and completely change up the menu, what seemed like almost in a day. My idea is to get these nutritionists into the stores like Walmart, Price Chopper, Garrey's that do donate to agencies such as mine, and push for produce donations. The shelf life of produce, such as fruits and vegetables, is not a long one, as we all know. So my question is, where is all of it going when it goes bad, or almost bad? And then also, with the help of some colleagues in the room, the second step would be distribution. A lot of my clients do not have vehicles, they have no means of transportation whatsoever, so they come there knowing that they can get food, but maybe we can get it to them specifically so that they don't have to come and get it.
And that's the concept of dignity. And so often we're so focused on just making sure people get resources that we forget that if there isn't dignity associated with it, number one, that impacts those people, but it also keeps an awful lot of people away to begin with. So there was a lot said today about improving access and removing stigma, which I think is really important, because then you're empowering people, and that's really ultimately what we're talking about. Excuse me, access to information, obviously, and there are ways for us to leverage technology. That's one of the great things that Springboard can bring to the table. A number of our advisors are world-class technologists and can bring resources to bear in that area. So I think we had some really good ideas today, and we've seen some really interesting programs that exist in other places that leverage technology that we'll follow up on. Information, whether it be recipes, I thought there were some great ideas about the culturally sensitive approaches that we really should be taking, and this goes back again to that dignity standpoint. I know visiting one food pantry where they spoke about people that are coming in that are new to the United States, and none of the food that's in the food pantry is familiar to them. So if we're able to address that better, that would make a really big difference. And then there's community awareness, which a lot of people spoke about, which I think is critical. And it's not just the people that may need the food pantry, it's everyone. Going back to what I said at the beginning about this being healthy food access for everybody. And then I think the next step beyond community awareness, and again it was mentioned, is community involvement. It's in every one of the food pantries I visited, there are people that are there all the time that are spending their time, but it's such a small group of people if we make the community more aware of the need, I think that we can increase volunteerism, and that could have a big impact on being able to expand hours and some of the challenges that we're already seeing. Obviously, improved access, whether it be delivery or addressing transportation issues. Obviously, fresh and healthy food, and would love to see it get to the point where it's not something where someone's surprised when they get to the food pantry that it happens to be fresh produce there, but they know it's going to be there. And I think there are a couple ideas about being able to even be aware, look online to see what's going to be at a food pantry so that you can actually make sure you're going at a time when there's food that you can use. Certainly surveys and focus groups and making sure we're getting the voice of the consumer, I think is really important. And I think just to summarize it all, it's about taking these ideas to the next level, getting organized around them, and creating specific plans that we can take action on.
It's a tremendous testament to this community that we continue to gather like this. Very excited to see where this goes next. And so thank you for everybody's input, everybody's observations and thoughts. I know there's a lot of work already happening within the community, and by no means do we want to do anything in absence of that work that's happening, which is why we're waiting until tomorrow's Food Policy Council meeting before we even look at any sort of integration of the ideas today with what we can do from a future perspective. So, open conversation, great conversation today. Thank you very much.